So, as Amy mentioned, my comments today are framed through my professional roles and multiple national advisories. Yeah,
Keep going, I'll see if I can get some.
yeah, no problem. So, I'd like to share with you an unfortunately all too common tale. So, Organization A implemented a digital solution that aggregates multiple imaging modalities, just like the one that we actually saw earlier, one of the presenters shared. It helps with GYN surgical planning. And so the solution was successfully implemented, and the healthcare delivery system saw impact both for patients in the form of better clinical outcomes, and for staff, less stress when planning and decreased time to planning. So inspired by these results, hospital system B decided to implement similar solution. And so they went to the same, sort of the usual implementation process, co-design, training, and implemented the solution. About 2 months after the solution had been implemented, one of the decision makers decided to go to the OR to sort of check out what was happening related to this GYN planning solution. And so they walked in and they saw, the supercharged images that were projected onto a monitor, but the entire healthcare team was huddled around a small computer looking at the traditional ultrasound images. And when talking to the healthcare team, the GYN surgeon sort of muttered, but was willing to share, I'm just not that interested in this solution. I just don't see how it will help my patients, right? And the unfortunate thing is this happens all too often, right? The halls of HITLAB are filled, really reverberating, both here today and virtually, on solutions that have avoided that asymmetric adoption. And yet we know that 70% of solutions, based on studies by Forbes, McKinsey, will not hit their mark, right? They won't hit. Oh, thanks, appreciate it. Trying to get. It's all right. It's okay. So 70% of solutions won't hit their mark, right? And so, the strategies that I'm going to talk to you about today really come from thinking about how we engage our workforce. Because, Amy mentioned, right, humans are still going to be a part of those digital technology solutions, especially any one of them that have to interact with traditional healthcare delivery. And so, thank you. And so I'm not going to be talking about sort of strategies that I think are a given. Right, things like co-design or co-production, the attention to training, a thoughtful plan around addressing cybersecurity concerns, and promoting interoperability. Yeah, it's okay. And so the first one that I'm going to talk about, thank you. The first one that I'm going to talk about is unpack success, and we saw sort of an iceberg earlier today. And in this case, right, oftentimes when I'm in pitches, as part of the decision-making team, people will talk about sort of the impacts or successes, 23% improvement in this outcome, right, a 30% reduction in cost, right, 10,000 more users per month, right? And yet the factors, that hard work and diligence and that granularity often sit sort of unpacked, are behind the surface or underneath the surface. And so oftentimes I will ask whoever's pitching, right, what were the factors that led to success? And sometimes we'll get sort of some vague answers. Yeah, we co-designed, right? But I really, I'm looking for those granular details that really make the difference when it comes to implementation. So for example, that GYN solution that I talked about before, it turns out that Hospital A did 2 moves that really helped crystallize success and resulted in sustained implementation. The first is that they built in time into their routine grand rounds and case conferences to talk about the solution and how it was impacting care. The second thing is, and David Berger mentioned this earlier, they started with a single use case, and the case was endometriosis. And they really worked on, well, how is this going to change care for complex surgeries related to endometriosis before we move to, all different types of considerations. We take this approach to really understanding the root causes of success so seriously that we've implemented success cause analyses within sort of our patient safety event analysis, right? There are lots of things that need to be fixed in healthcare, right? But there are also awe-inspiring things that happen every day, right? And how do we learn from what contributed to those successes is something that we have seen really change both culture and practice. The second sort of strategy or bucket of strategies to engage healthcare workers is to align technologies with values. So I work for New York City Health and Hospitals, which is the largest municipal health system in the country and serves all New Yorkers, right? And we have the real pleasure of serving amongst the most diverse communities in the world. And I see all the time staff's ears begin to perk up when you don't just say 10,000 users, right? But really, how does it relate to their patients, right? It means that 10,000 more patients can have access to education in the languages they prefer, in the formats they prefer, at the times that they prefer it, right? All of a sudden, that's a big difference than a data point on a chart. The second strategy I want to talk about is the link to safety culture, right? This is a true alignment with values. And what I mean by that is safety culture is really the beliefs and actions that an organization takes to advance patient safety. And not a surprise, but organizations that have better safety culture have better outcomes. Now, what's interesting about safety culture is that it is an accreditation requirement, so AKA Joint Commission and other accreditors requirement to measure safety culture via surveys or perceptions of staff perceptions of safety culture every 2 years. So it means that this is a consistent data point that people are looking at, right? And so how can your digital technology solution, right, whether you're an investor or a founder, right, really tag to an organizational need, right, related to safety culture? And so, these questions are freely downloadable. And I spotlight this one here. The unit regularly reviews work processes to determine if changes are needed, right? Link back the work that's being done, right, with digital solutions to safety culture. A third really crucial strategy is really thinking about how does the digital solution impact emissions and impact waste reduction, right? About 9% of greenhouse gas emissions in the United States are due to healthcare delivery, about 5% globally. So it's outsized. And what's really fascinating is that a Commonwealth Fund survey, so a well-respected survey, surveyed clinicians and found that 80% believe it is important for their hospital to address climate change. I mean, there's not very much that, like 80% of healthcare workers will get behind. And yet we see this over and over again, right? People are interested in climate action, climate impacts, and we'll find that people are actually coming for the climate action, staying for the improvement, right? Regardless of what the solution is. And so, when you think about implementation of digital solution, make sure you're talking about sort of the impacts on waste, right? Waste reduction, because it matters and it's really important to engage staff in that way. A third sort of bucket of strategies are develop metric displays that matter. We saw some pretty great, sort of metric displays yesterday and today, right? And what I'll find is that oftentimes, in the era of co-pilots, right, everyone gets a little creative, and you'll often find really, really jazzy infographics, right? Something like this, where there's a few sort of big numbers and bubbles, maybe a graphic that does or doesn't need to be there, right, and sort of a few other things. But then when you start to sort of ask more, right, like staff will ask, well, tell me, how did this change over time, right? What actually happened? The unfortunate thing is sometimes you'll get things like this. And they're like, whoa, what do I do with that, right? So this is an evergreen example from Harvard Business Review, and I use it all the time, right? So they were trying to look at sales by time of day. It's hard to make meaning, right, with all these sort of sticks, right? And you can, it looks like the animations didn't go. But the point here is you can smooth it out by making it a line. But if you zoom in, what you'll see is there's a huge shift that happens throughout the day. And so if I could show you the final product, what you'd see is a smooth line where there's a crossing over from desktop use to more mobile and tablet use. And the point here is that, data tells a key story. And I would posit that data design and how you choose to, sort of craft your data displays is as important as the user experience for the solutions themselves, right? Because at the end of the day, that's what's going to be able to track impact and help engage people over and over again, especially when some of our EHR-related displays really look like an airline-like cockpit, right? And so be thoughtful about your data displays because I've seen over and over again it really matters. The last thing I'll say before I close is be clear on what is sunsetted. Right? Oftentimes digital solutions will talk about, and you'll be able to do this, and you'll be able to do this, and you'll be able to do this. It is equally important to talk about what comes off of people's plates. Now, I'll be the first to acknowledge that in healthcare, we're just not great, right? We're just not great at sunsetting. It seems that for every policy we sunset, we get 2 more, right? But the point here is that this is an important opportunity to have alignment on timelines and expected deliverables over time. And I've seen conversations really begin to unlock and people really get behind solutions when you start talking about not just what is awesome about it, but what is also awesome about what it takes off of people's plates. So be deliberate about that. And so, at the end of the day, right, we've talked a lot yesterday and today about the power of digital technology. We've already seen examples where it has transformed care. And through careful engagement of humans and really thinking creatively about how we engage the beautiful humans that are healthcare workers, there's no doubt that we can continue even further and faster down that digital transformation journey. Thank you very much.